1. A nurse is caring an anemic patient. What finding? Should suggests her that it is acute blood loss anemia. A. Exertional dyspnea. B. Easy fatigue on exertion. C. Bradycardia at rest. D. Postural hypotension. Answer D. Postural hypotension. 2. For what complication should a nurse monitor a patient? When an oxytocin infusion is used to induce labor. A. Intense pain. B. Uterine tetany. C. Hypoglycemia. D. Umbilical cord prolapse. Answer B. Uterine tetany. 3. Maternity nurse must be aware that screening for diabetes mellitus in pregnancy is done at A. 6 to 17 weeks. B. 18 to 23 weeks. C. 24 to 28 weeks. D. 29 to 32 weeks. Answer C. 24 to 28 weeks. 4. Nurse working in an operation theatre must note the risk of HIV infection with needle stick injury is about A. 1, 100. B. 1, 200. C. 1, 300. D. L. 400. Answer C. 1, 300. 5. A nurse is caring for a patient with swine flu and she has to give the drug of choice for swine flu and it is A. Acyclovir. B. Adafovir. C. Cidofovir. D. Oseltamivir. Answer D. Oseltamivir. 6. An infant is born precipitously outside the labor room. What should the nurse do first? A. Tie and cut the umbilical cord. B. Establish an airway for the newborn. C. Ascertain the condition of the uterine fundus. D. Arrange transport for mother and infant to the birthing unit. Answer B. Establish an airway for the newborn. 7. What is a nurse's primary critical observation when performing an assessment for determining an APGAR score? A. Heart rate. B. Respiratory rate. C. Presence of meconium. D. Evaluation of Moro reflex. Answer A. Heart rate. 8. Patient on enalapril and diuretic therapy for heart failure. Nurse should notify the physician that the therapy is not effective when she finds A. Dry cough. B. Skin rash. C. Edema legs. D. Postural fall INBP. Answer C. Edema legs. 9. Heart rate of a healthy alert neonate may range between A. 120 and 180 beats per minute. B. 130 and 170 beats per minute. C. 110 and 160 beats per minute. D. 100 and 130 beats per minute. Answer C. 110 and 160 beats per minute. 10. Nurse is about to insert Riley's tube for a patient. Before this act she must aware of the distance between incisor teeth and gastroesophageal junction. Which of the following is correct distance? A. 30 cm. B. 40 cm. C. 50 cm. D. 60 cm. Answer B. 40 cm. 11. Nurse is about to catheterize bladder of a pregnant lady. She should be aware that all the following facts about female urethra are true except A. It is about 1.5 inches is length. B. It's posterior to vaginal orifice. C. It pierces through urogenital diaphragm. D. LT is straight and offers minor resistance for catheterization. Answer B. It's posterior to vaginal orifice. 12. Which one of the following cancer that does not metastasize commonly to liver? A. Breast. B. Lung. C. Colon. D. Prostate. Answer D. Prostate. 13. All are true regarding vitamin A except A. It is found in green leafy vegetables. B. High dose in pregnancy is teratogenic. C. Supplementation reduce mortality in measles. D. Supplementation reduce morbidity in diarrhea. Answer A. It is found in green leafy vegetables. 14. Nurse giving oxygen therapy should know that it has to be humidified because A. Oxygen is a hot air and it may burn trachea. B. Oxygen is a dry gas and thickens the mucus. C. Oxygen gets cleaned of pathogens by humidification. D. Oxygen is easily absorbed because humidification. Answer B. Oxygen is a dry gas and thickens the mucus. 15. What is the most common side effect associated with the use of intrauterine device? A. Tubal pregnancy. B. A rupture of uterus. C. Expulsion the device. D. An excessive menstrual flow. Answer D. An excessive menstrual flow. 16. To avoid pulling the urinary catheter, nurse should tape the catheter on patients. A. Upper thigh. B. Lower thigh. C. Hind leg. D. Foot. Answer A. Upper thigh. 17. 16-year-old primigravida patient admitted with severe pregnancy-induced hypertension is given intravenous magnesium sulfate. The nurse should obtain which one of the following information? A. Urinary output every 8 hours. B. Deep tendon reflexes every 4 hours. C. Respiratory rate every hour. D. Blood pressure every 6 hours. Answer C. Respiratory rate every hour. 18. An active male patient who weighs 180 pounds 81.65 kilograms has undergone dietary instruction. The patient reports that his current diet consists of 60 grams of fat, 200 milligrams of cholesterol, 5 grams of sodium per day. What a nurse advised the patient to do? A. Increase his cholesterol. B. Increase his sodium. C. Decrease his cholesterol. D. Decrease his sodium. Answer D. Decrease his sodium. 19. W hat is the most common complication for which a nurse must monitor preterm infant. A. Hemorrhage. B. Brain damage. C. Respiratory distress. D. Aspiration of mucus. Answer C. Respiratory distress. 20. How long should a nurse wait after taking cold milk for recording oral temperature? A. 5 to 10 minutes. B. 10 to 20 minutes. C. 20 to 30 minutes. D. 30 to 40 minutes. Answer B. 10 to 20 minutes. 21. Maternal death rate is expressed deaths per A. 1000 live births. B. 1000 pregnancies. C. 10,000 live births. D. 10,000 pregnancies. Answer C. 10,000 live births. 22. Which of the following indices a nurse has to consider as an indicator of good nutrition? A. Albumin level 2.5 gm per deciliter. B. Pre-albumin level 18 mg per deciliter. C. Transferrin level 244 mg per deciliter. D. Total lymphocytes 1900 microliter. Answer D. Total lymphocytes 1900 microliter. 23. A nurse is caring for an old lady with osteoarthritis and all the following facts are true regarding osteoarthritis. Except A. Crepitus. B. Tophi. C. Subcutaneous nodules. D. Pain on moving the joint. Answer B. Tophi. 24. The nurse is caring for several mother-baby couplets. In planning the care for each of the couplets, which mother would the nurse expect to have the most severe after birth pains? A. G4, P1 patient who is breastfeeding her infant. B. G3, P3 patient who is breastfeeding her infant. C. G2, P2 cesarean patient who is bottle feeding her infant. D. G3, P3 patient who is bottle feeding her infant. Answer B. G3, P3 patient who is breastfeeding her infant. 25. Which one of the following is not a described type of female bony pelvis? A. Android. B. Gynecoid. C. Obstetroid. D. Anthropoid. Answer C. Obstetroid. 26. Benefits of breastfeeding include all except A. It provides nutrients. B. Colostrum provides a high level of immune protection. C. Less prone for gastrointestinal infection. D. It provides adequate iron for premature newborn. Answer D. It provides adequate iron for premature newborn. 27. Which IUCD needs to be replaced only after 10 years? A. Copper T200B, Progestasert. C. CUT 388. D. Nova T. Answer C. CUT 380A. 28. A newly married healthy couple is asking for the best method of contraception and which of the following methods a nurse will advise? A. Barrier method. B. Rhythm method. C. Intrauterine devices. D. Combined oral pills. Answer D. Combined oral pills. 29. Oxygenated blood enters the fetal circulation from umbilical vein via A. Ductus venosus. B. Ductus arteriosus. C. Intrahepatic vein. D. Intrahepatic artery. Answer A. Ductus venosus. 30. Persistent generalized lymphadenopathy is caused by A. HSV. B. HZV. C. Half D. HIV. Answer D. HIV. 31. Which one of the following viruses cause post-transfusion? Hepatitis A. Hepatitis A. B. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer C. Hepatitis C. 32. Which one of the following statements by a patient with backache should alert the nurse? A. Pain on movement. B. Pain radiating leg. C. Perineal anesthesia. D. Pain sensation lost in feet. Answer C. Perineal anesthesia. 33. In India at present infant mortality rate is around A. 29. B. 49. C. 39. D. None. Answer C. 39. 34. Drug which is contraindicated in head injury. A. Morphine. B. Antibiotic. C. Oxygen. D. IV fluids. Answer A. Morphine. 35. The nurse explains to the mother of a neonate diagnosed with erythroblastosis fetalis that the exchanges transfusion is necessary to prevent damage to A. Liver. B. Lungs. C. Kidneys. D. Brain. Answer D. Brain. 36. All of the following are complications of twin pregnancy. Except A. Abortion. B. Post-maturity. C. Low birth weight. D. Congenital malformations. Answer B. Post-maturity. 37. Nurse carrying a high-risk pregnant lady with heart diseases must know which one of the following valvular carrying a high-risk